in this country, this young kid assassinates a healthcare executive, and underneath that, the big surprise is the level of anger, the level of sympathy for the kid, and the level of anger against these algorithms that are now being deployed not to make things more efficient, but to help them deny coverage or to not pay certain things. And that's the counterweight, is it not?
Well, yes or no, right? I just did this big post on Blue Sky, M Cuban on Blue Sky, if you want to read it.
I don't even know how to log on to it.
It's easy.
I know I'm supposed to migrate there. I have no idea how to get on it.
Yeah, it's actually a great platform. Just download that app, Blue Sky.
All right.
But in any event, the bigger question is, why are we putting insurance companies in that role?
The role of denying? I thought that's...
Yes. Pre-authorizations. Why would anybody hire an insurance company who tries to make money by reducing the amount they pay out? That's their interest. Why would we ask them to do pre-authorizations?
That's the whole business model. That's what we're trying to get out of. I completely agree.
Right. But the whole point is probably half the people who are covered in this country, the insurance companies are involved, but they don't really act as insurance companies.
Well, they're adversarial.
Well, no, what I'm saying is there are 50 million lives covered by self-insured organizations, from companies to, unions, whatever it may be.
Mm-hmm.
And they use insurance companies for their network, all the hospitals they put together, and for their apps, but they also use them to do the pre-authorizations. And my question to them has been, over the past 4 or 5 months, has been, why are you using insurance companies for pre-authorizations when you CEO of that union or company are, basically the ones that make that decision whether or not you're willing to pay for it or not?
But there's so many different ways that money is sucked out of that system. You're talking about, money out of your paycheck to pay a premium that has a deductible. So you're still paying this
Let me just tell you how insane our healthcare.
It's truly insane.
Right. There's something was mind-boggling to me. I was almost this many days old when I found this out.
Okay.
When you think about your deductible,
mm-hmm.
your copay, and your co-insurance, right? What it is you have to pay up to before the insurance company kicks in. Your copay, a specific amount to see a doctor, or your co-insurance, like on original Medicare, where you have to pay 20% or some percentage of the total.
That's right.
Do you know who accepts the default risk on all of that?
I would assume the patient.
No, the hospitals and the doctors take that credit risk. And they literally, yes, it's insane.
But then why are patients going bankrupt when they can't?
So that's what happens. So we're turning hospitals and doctors into subprime lenders without assets against them.
Oh, Jesus. Okay. I see where you're going.
Right. So now I'll play it out. You're a hospital. When I talk to hospitals, a lot of them, they have default rates are 50 to 60% or more, depending on where the hospital is located. So now this hospital, half the deductibles, copays, and coinsurance that they are supposed to be paid by the patient, they don't collect on it. So a couple things happen downstream from there. One, they turn into like a mortgage servicer where they try to collect it.
Mm-hmm.
And it makes them look bad. They hate being put in that position because there's no upside. Maybe you collect some money, but on the downside, the patients hate you. The whole world hates you because of all the patient debt and medical debt and bankruptcies as a result. But when you can't collect them, what do you do to compensate for that lack of revenue? You jack up your fucking price.
Right. So we're all subsidizing this system of delinquency to some extent.
No, nobody. It's just the hospitals accept that risk. And I guess you could say we subsidize it when you cash pay a higher price.
Well, that's what I'm saying. If they're jacking up their prices and either insurance pays it or you pay it, that's subsidizing this much larger default rate in a system.
But it gets worse. It gets worse.
Okay.
And so now these providers, the hospitals and doctors, they negotiate with the big insurance companies. And it's fascinating if you walk into a hospital to pay for an MRI, as an example, and you don't mention your insurance, you just say, I want a cash price. They'll probably say it's $350 to $450, depending on where you live. That same hospital will negotiate with what they call the BUCAs, the big insurance companies, right? For that same thing, they'll negotiate a price of $2,000.
What?
Yeah, so you would think that big insurance company negotiating with the hospital, and that insurance company covers millions of lives. They insure, or deal with
Why wouldn't they
millions.
negotiate that if it's a bulk thing to $100? Why would it be higher?
Because the hospital needs the insurance company as a sales funnel to bring patients in so they can, pay their bills. And the insurance company wants that price to be higher, particularly for things like the ACA, because the ACA requires for all the plans they cover that they spend up to 85%. So having
How is this not collusion then? If both sides need it to be higher, that's colluding on a certain price. And beyond
Well, but
that,
if it's by law, it's by law the way the ACA works. So think about this, John. So somebody who gets an individual plan on the ACA, say one of the bronze plans, which is the least effective, right?
right.
And it has a $9,000 deductible. So this individual can't afford much of premiums, decides they want a 9,000 deductible. You know who's truly subsidizing that deductible? The fucking hospital.
Wow.
And when you get your insurance or anybody
Right.
gets the insurance from a big company and they show you 5, 6, 7 different plans, and one of them is a $1,500 deductible, but you're 25, and so you take the $5,000 deductible. Who takes on that risk of the $1,500 versus the 5,000? The doctors in the hospitals.
But you still pay the price on your credit score and on a bankruptcy. Like,
Yes. Now there's a limit, like only if it's above 500, they change some of the rules. And for some of the lost money by the hospital, there's this thing called dish payments that the government will give the hospital to try to make up for it, but it doesn't.
but isn't the whole fucking system, Mark? Isn't it all, especially with the ACA, a bribe? Isn't it a governmental bribe to give to hospitals and insurance companies to say, as a way of saying people with pre-existing conditions have to be able to get themselves some coverage? The whole thing is almost $1 trillion bribe. And when you look at the levels of profits that are rolling through these insurance companies,
Yeah.
clearly we find ourselves in an unsustainable moment.
Clearly, but it's worse than that because it's the government making the determination of which insurance plans that they approve for Medicare and Medicare Advantage.
Well, that's when they tried to privatize Medicare. I don't understand, with the satisfaction most people had with Medicare. Now they've gone to privatizing that Part D or whatever they call it, and that's starting to this. Let's back up for a second because this brings us to a very interesting point that I want to ask you about. All right. It seems to me that with all the checks and balances within the government, legislative, judicial, executive, all those different things, the one thing the founders didn't really add into the equation is corporate power. This idea that there has to be an entity that is large enough to, in some ways, be a counterweight to unfettered. The system we've chosen for progress and money is incredibly efficient at creating wealth, but it has a lot of collateral damage.